Hey friends, I'm Dr. Schultz, and this week I'm answering a letter from Jimmy in Pittsburgh, Pennsylvania. Now really I could just say, do everything Incurables program, and I wouldn't even answer a letter like this, but he has a lot of questions that are very similar to hundreds of questions that come into me every month. So that's why I'm going to read his letter and answer his questions for all of you to learn, because again, many of you ask me these same questions. Okay, Jimmy's 33 years old and was diagnosed with Crohn's disease 10 years ago. I'll give you a quick story. Over the course of that year, I experienced periods of cramping and blood in my stool, and eventually wound up in the emergency room and told by the attending doctor and surgeon that he was 70% sure it was appendicitis, and I'd be going home the next morning. Okay, when you ask a surgeon, what do you think you should do? What do you think they might say? Surgery? Okay, think about this. I tend not to ask questions about what I should do to surgeons. I woke up with multiple tubes running in and out of me and an incision down my abdomen as a result of an emergency bowel resection. I experienced an extremely difficult healing process resulting in a wound vac and years of scar revision that still isn't complete. The attached photo, oh please, don't make me look, is the incision, blah, 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 blah. In lieu of lowered self-esteem from all my scars, I've opted to keep some of the scar tissue and forgo the more surgeries. I've been seeing a world-renowned gastroenterologist doctor once or twice a year. I've been moved off on multiple pharmaceuticals. I now take 20 milligrams of this, 10 milligrams of this. My last colonoscopy was a few months ago. I lost 18 pounds this year by sticking to a regimented workout routine and trying to consciously eat healthier. Trying to consciously eat healthier is a sign here. Okay, most people I know that are healthy are trying to consciously eat healthier. You've been gutted by medical doctors, almost died, are asking me my help. I don't think consciously trying to eat healthier is a place you should be, but I'll be fair, I'll read the rest of it. I think you should be not on emergency surgery. You should be on emergency lifestyle change. Emergency Dr. Schultz program, which is the Incurables. I still have near daily Crohn's attacks, reoccurring sinus infections, lethargy. I don't feel well. I'm working to lose another 15 pounds. I'm 5'11". I weigh 205 pounds. You're fat. You're very heavy. 50, 60, 80 pounds overweight. I'm not going to get my calculator out. But more importantly, I want to knock out my Crohn's disease and live a healthy physical and spiritual life. I don't want to end up crippled by the disease or worse. I have 3 young kids, a beautiful wife. I want to get this turned around. Okay, I'm behind you, brother. I know you think I'm beating you, and I am. And if you were in my clinic, I'd have you down on the floor in handcuffs, and I would be beating you. My brother-in-law has been an advocate of yours for years and directed me to you. I read There Are No Incurable Diseases, Good Choice, and studied the schedule of treatment. I've decided to make the leap of faith, and I want to go forward with the Incurables plan. I'm currently working on a healing partner. Good, important to have a healing partner. You obviously read the book. Testing out hydrotherapy in the shower and just started taking superfood my brother-in-law got me for Christmas. Awesome. But I have a couple of questions, and the only reason I'm answering them is because you read the book, you're looking for a healing partner, you're testing out your hydrotherapy, and you're starting to take your superfood, so you deserve an answer from me, brother, and here we go. Will my bowel resection be affected by the high enemas? No. Should I remain on my medications? No. But medications I always advise to wean off. Take a month or 2 and start weaning down and weaning down and weaning down and weaning down. You stress the focus and attention and therapy on the infected area. One of the hard things with hydrotherapy is that the infected area is close to my genitals and the hot water really hurts. What can I do? Tough it out, brother. You almost died. The medical doctors gutted you. Tough it out, okay? Heat up the gonads, no problem. Heat up the penis, then freeze it off. Do the hot and cold. No wimping out there. The hydrotherapy is going to change your life. Based on my condition, how many times during the 30 days should I do a high enema? You know, for you, based on your condition, I would do it exactly the same as everybody else for the Incurables program. Based on my condition, how many times should I do the cold sheet treatment? Same thing. That got me nervous, by the way. You know what? I know, but what makes me nervous is emergency surgical resections and all the problems you had. You still have irritable bowel syndrome. Here's my worry about you, Jimmy. If you don't turn this around, your prognosis is not good. You still have irritable bowel. That means your bowel's still cooking down there. There's still infection. There's still inflammation. There's still scar tissue. Don't wimp out on the Incurables program. If we could see everything that was going on inside your body's not happy, it's diseased, it's getting worse. You're either getting better or you're not. And right now you're not. And I need you to be getting better. I felt like I had someone standing on my throat with this disease, and pray and hope for liberation. Thank you in advance. Don't pray, don't hope. You got to do it, brother. Jimmy, you got to do the Incurables program, the cold sheet treatment, the hydrotherapy, take the herbs, recreate a whole new food program, because everything you eat is what goes in here and what's irritating you. And Crohn's disease you can get rid of in a month. Every patient of mine with Crohn's disease got rid of it in a month. Changing their food program and taking a few herbs to reduce the inflammation. You can do this, but you got a big turnaround. I know what I'm asking. I know what I'm saying. But my patients that did this made miracles happen in my clinic and changed everything around. Throw it to me over here. I'm on a roll. Intestinal formula number 2. The absolute cure for Crohn's disease, except I can't say that. Herbal mucil plus the same thing. Get the poisons out of your bowel. Get the poisons out of your bowel. Get your bowel soothed, the inflammation down. Get rid of that Crohn's disease. Get the food program going. You can do it, brother. I'm behind you, literally, with my foot in your butt.